My name is Andy Laguno. I'm the Associate Athletic Director for Health and Performance, and today we're going to do a tour of the Athletic Training Room / Sports Medicine Center. Come on in. At the University of Rhode Island, we have 18 varsity teams, roughly about 500 student athletes. 200 student athletes come in and out of the athletic training room on a daily basis. We use an accelerated rehabilitation approach, taking all precautions under the direction of our team physicians. Our job is to keep everyone healthy and being able to participate. Our staff is comprised of 10 certified athletic trainers. We are all nationally certified and state licensed to practice medicine. Most of us have additional certifications in strength and conditioning, performance enhancement, and corrective exercise specialist. We also have different certifications in manual therapy techniques such as muscle energy, Grasson's techniques, dried needling, cupping, functional muscle screening, massage, postural restoration, and joint mobilization. The staff has years of experience to be able to provide the best possible care for our student athletes. Within the training room, we have 20 treatment tables. We also have a taping room with easy access not to disrupt daily treatment sessions. We have a warm-up station and post-surgical treatment tables that are also used for evaluations. In the training room, we use an online software documentation. Every time an athlete comes in, we can chart their treatments and document on a daily basis. In our main facility, we have a first aid station, which we follow OSHA guidelines. Our main treatment area has modalities with different protocols for acute, subacute, and chronic injuries. Our hydrotherapy area has both a hot whirlpool and a cold whirlpool. You can fit a few people in each one. Our functional therapy area has free weights, aerobic equipment, cross-training equipment, gives us some space for movement and training. We like to put athletes through a mini workout before we release them to participation in the weight room. During the week, we have medical clinics. We have 2 exam rooms in the athletic training room. On Monday, we have our primary care physicians come in. We use the physicians from Student Health Services. On Tuesdays, we have a nutrition specialist. Wednesday, we have an orthopedic clinic. Thursday, we have chiropractor. Friday, we have a podiatrist. The idea is to bring the physicians to the training room so the athletes don't have to go off campus. Student Health Services is located 3 minutes from the athletic training room. Inside the facility, they have a pharmacy. They have physicians and nurses with all primary care needs, imaging, and x-rays. The athletic training room also has access to seeing the images for x-rays and MRIs within our medical exam rooms. We have a nutrition specialist that spends 1 day a week with us in the training room to help with our student athletes. She does individual sessions with the athletes, team lectures. She leads the multidisciplinary eating disorder team. She does outreach with the dining hall services, the School of Nutrition, and also works at Student Health Services. Our sports medicine department has access to different kinds of specialists, from cardiologists, neurologists, a dentist, ENT, vision specialists on and off campus. We can usually get appointments within 24 to 48 hours. Our athletic trainers work closely with the strength and conditioning staff. Strength conditioning has 5 nationally certified strength conditioning specialists. They have a state-of-the-art facility. There are 14 individual weight stations that are fully independently equipped. They have an aerobic area, a large turf for performance movement, and TV monitors with workouts posted. The athletic training room is located right next to the pool. Within the aquatic center, there are 3 pools. One of them is a shallow pool. It goes from 3.5 feet to 5 feet of water. This pool can be utilized for both upper and lower extremity injuries. One example would be an ACL therapy. It can accommodate for large teams doing conditioning and low-impact recovery training. Our main athletic training facility is located in the middle of the 4 buildings. We have 3 additional satellites. One is right next to the football locker room on the 50-yard line. The other taping room is between both men's and women's basketball locker rooms in the same arena where they play. And we also have our last satellite outside on the practice fields. Some of our additional providers are physical therapists. We use them for post-surgical cases. We have counseling services on campus. We utilize the Psychological Consultation Center. We have access to 3 or 4 counselors that are dedicated specifically to our student athletes. The counselors help not only with their athletic identity, but also their personal identity. The athletic training room is a learning facility. We educate not only athletes and coaches, but our students at the same time. They can be either volunteers, interns, or master level students. This allows them to have some hands-on experience and network with our team physicians and providers and resources within the training room. Violence prevention is housed under the sports medicine department. There is a bystander intervention program which focuses on community, equality, and diversity. The goal is to do training and education to both our staff and our student athletes. South County Hospital is located 5 to 10 minutes off campus. It's a Trauma 1 facility. Rhode Island Hospital is located 25 minutes off campus. Our team physicians have access to both hospitals. Our sports medicine department has a website. It's gorody.com, Inside Athletics, Sports Medicine. Within this link, we have policies and procedures, the sports medicine manual, other links, educational information, PowerPoints, and videos. We created a unique integrated system to sports medicine, taking a team approach to promote health and performance. This concludes our sports medicine facility. Thank you, and go Rams.